dealing with this as a problem, which is to say that from your perspective, I would imagine that you played a very important part in helping to pull this committee together, that is, looking at the membership and whatnot. But now, from your perspective, what have we done in terms of narrowing the gap? Have we narrowed the gap?
Well, I think it might be a bit premature to get into percentages and talk about, specifics. I think what we have been able to do is to identify individuals like Reverend Robinson, who are multidisciplined in nature, who can bring so much more to the table when you talk about holistic health care. We no longer have this tunnel vision, I think, when it comes to dealing with what I like to call unorthodox problems. When you talk about health care, I like to think about the World Health Organization definition of what health care is. It's a very broad definition, one that deals with fair housing, adequate housing, fair employment, quality public education. Those are the kinds of considerations that we see that are going to be critical to really narrowing the gap and to really place the burden of responsibility unilaterally on one particular department is not realistic. If you talk about bringing together and bringing to bear all the resources that might be available at various units of government to impact upon a problem, then you can really talk about narrowing the gap. When you talk about not requiring a single parent mother who's age 15, who's got 2 kids to make a choice between staying at home versus going to school because she doesn't have daycare, then we're talking about narrowing the gap. When you talk about restoring the family structure and having the father there, and when you talk about nuclear family, and when you talk about the extended family, and not have to worry about, well, where do you put, the elderly parent in a nursing home because maybe you can't afford to keep them at home. Those are the kinds of issues that this task force under Dr. Robinson's leadership is going to be really charged with dealing with.
I'm smiling because, of course, as a minister and a person who ministers to the whole person as a community entity within the institution of the church, I'm very much impressed with the direction that the task force and the department has taken. We're talking about education for young people. A dropout of school is going to be at a higher risk of becoming subject to substance abuse, to too early pregnancy, to low birth weight infants. A person who drops out of school is going to have an inferior job. He's going to be underemployed, if not unemployed. Underemployment and unemployment may very dramatically alter access to health care. When health care is extremely expensive, and if there are no third-party payers to foot the bill, then those individuals may have decreased access. Decreased access then leads to the presentation at later stages in the disease process, both for chemical dependency, other chronic diseases, pregnancy, no first trimester prenatal care. So really there is a panoply of factors involving families and individuals, and it is bigger than health in the classically defined sense. We're talking about all those socioeconomic issues and variables.
Well, now how, Dr. Robinson, do we bring all of the resources that are necessary in order to deal with this holistic approach? Taking what he said in reference to health being child care, health being education, and et cetera, when we recognize that in Nashville alone, we're concerned with a deficit of some $60-odd million in our school budget, and there's a lack of health care facilities, and on, and I could enumerate on and on and on. How can we take a holistic approach, and what are some of the resources that will be available for us to do that in lieu of the fact that we don't have the financial resources?
That's an excellent question. I think, however, if we look holistically, then literally we have to look holistically. We cannot only look to the public sector and to governmental funding, but we look holistically at the whole environment, the whole community. And many resources we have at our disposal, even within the African American community. Obviously, I have a tremendous interest in the role of the African American church. The church has traditionally been a healing institution, a therapeutic community. There are many things that the church can do in, once again, reestablishing what we value and what we should value, what is right, what is wrong, what are the norms, what is abnormal. The church has a critical role in promoting positive lifestyles and healthy choices in our African American youth. again, we can look to our schools. One of the traditionally defined roles of the school system is to develop young people that are able to appropriately function in a contemporary society. Well, that may mean very different things today. And so our school systems are trying very desperately, of course, to incorporate a variety of prevention curricula into what is happening in the classroom. Certainly, what is the role of the family? How can we boost the role of the family? Some of that does not require financing, certainly not public financing, but just our ability to define and redefine who we are and what we are to be about. Social service agencies, community-based nonprofit organizations, parks and recreation. But eventually, we're certainly going to be continuing to look to local, state, and federal government for giving us assistance in providing a little nudge to well-meaning community-based efforts. And it will be the Department of Health, it may be the Department of Mental Health and Mental Retardation, it will be housing, it will be employment, it will be the federal government, it will be Metro Social Services, Human Services at the state level. All of those entities will begin to have, we hope, the big picture and look at it from an umbrella perspective. How can we alter all of the variables when we think that there is still a 10-year disparity and discrepancy between the average life expectancy of a white American and African American? We have to look at a variety, a multitude of variables. Some of them may be genetic, probably. Most of them are not. They are socio-environmental. And so to look at the issue holistically is really going to require a holistic base of resources.
Very good. Now, the Department of